Let's get some more reaction to the Health Minister's comments. We are joined by the President of the Democratic Nursing Organization of South Africa, Demosa, and that is Simon Hlungwani, who joins us from our Pretoria studios. Thank you so much for coming through, Simon Hlungwani. So the Minister says he didn't use the word crisis in reference to our health sector and says it's a choice of words. If the word crisis comforts you, well, so be it. TAC says there's a crisis, the Treatment Action Campaign. The South African Medical Association says there's a crisis. And of course, who can forget the Health Ombudsman saying there's a crisis? What do you as Demosa say?
Well, we agree with the Ombudsman that the health system in South Africa is about to collapse. It's just at the verge of collapse. So we agree with SAMA as well that it's in a crisis. We agree with Section 27 and everybody who says that, because all evidence points to the failure of a system itself. And I think the World Health Organization has acknowledged that the South African health system is one of the weakest in the world. We agree with that.
So how do these weaknesses manifest? I mean, you represent nurses who are at the coalface of primary health care delivery on a daily basis. What is the picture that emerges from the nurses that you represent?
Well, before I get to the pictures of the nurses, we must take note of what is it that we look into when we say the system is stronger. At the current moment, if you go to rural areas, you will be shocked at the level of the queues that you get in the clinics. You will be shocked at the level of non-medication availability in the clinics. So you find old age people who are in chronic medication who will be told there are no medication, they must go. Some are told you must go and buy medication on your own. Some are told you must come after so many days. So those are just simple evidence of that. The other information that can assist you to understand is the long list for operations in hospitals, where you find that one would have to wait to be operated after 3 months or 6 months. Over and above that, you go to all clinics and the hospitals, you'll find a huge shortage of nurses, health professionals, as well as doctors. There are many hospitals in rural areas that operate without doctors in most of the time. You go at night, it becomes a luxury, whether you're an emergency or not. And you can see a lot of patients that are being transferred from one place to the other in order to receive care. You can talk about Mpumalanga, Limpopo, sending patients to around Gauteng and so on. And our nurses are tired because they are taken as a scapegoat all the time. Currently, as it is, there is a huge moratorium in all provinces. But the minister and everybody working for government will never admit if nurses retire and if nurses die and everybody who decide to resign, they are never replaced. They are told there is a moratorium. But in public, they claim that the moratorium does not affect health and education. But in practice, no one is being replaced. We can show you information in all the hospitals.
So when the minister says the problems and challenges that are there, that he's not calling a crisis, have to do with, the demands on the health system, and that, it's not on the verge of collapse, and says, for instance, on things such as shortages of medication, he says, well, we have a system where we can monitor from Pretoria the levels of stock availability, and there's nothing that points to stock shortages in the country. Is he out of touch of reality? Is that what you're saying?
I would think that he's a human being, and all human beings have got defense mechanism. And for me, it is the same as, if I were to give an example, if you have a country and the economy of the country collapses, I don't think there's a president who can admit that he is responsible for the collapse of the economy. The minister is responsible for health and the systems in the country at large. And if there's problems in there, the first thing first he ought to have done is to admit there's a problem, and then he sits down into designing mechanisms to correct that problem. But with his current defense mechanism, he's failing to deal with the problems because he does not acknowledge that there is a problem. So we generally think it's a defense mechanism because it affects him directly, that he has failed to ensure that he puts systems in place and he ensures that he puts standards in place whereby the provinces are going to comply with what is set out, like he would have done with with ensuring that they establish the ombudsman and many other systems. So we're saying in all the areas that are currently challenging the country, it is because the minister is directly failing to deal with them. He is overwhelmed.
Should he step down?
Certainly, because clearly he's a good minister. We may love him for whatever and the charisma and the good publicity he's got. But when it comes to health, clearly it points back to him. He's failed to ensure that systems are in place. He's failed to ensure that all provinces are functional. This is despite the fact that he will always complain about the constitutionality, that the prerogative lies with the MECs and all that. I know that they sit on quarterly basis where they sit in the National Health Council. That's where they must be sitting and dealing with these systems. It means they've been sitting all these years, every trimester, but they're failing to reverse the problems that we're having in our country. Remember, the only way that we can say we are never tested as a South African health system, it's only because we've never had serious crisis like the Ebola outbreak. I ask myself, if you can have an Ebola outbreak in a rural area, how is the health system of South Africa going to respond to that situation? I bet with you that we would have dire consequences than we can imagine. It's just that at the current moment we have never been tested like other countries have been tested.